This is frequency of multiple opioid overdoses per individual in Connecticut during a 7-month period. My name is Suzanne Doyon. I'm the second author on this paper. We have no conflicts of interest for any of the authors. Background. Opioid overdoses kill 47,000 people per year in the United States to the rate of 130 people per day, and billions of dollars lost in public health costs and lost productivity. There are two basic paradigms to understand people who overdose and relapse in their overdoses, one from politicians and one from medicine or science. Opioid use disorder, OUD, is a chronic disease that is relapsing, and that's an accepted medical definition. So are diabetes and chronic kidney disease, and they have relapsing rates as well. Non-adherence rates in diabetes are 10 to 60%, and in hemodialysis patients, 12 to 99%. Yet when the opioid use, person suffering from opioid use disorder relapses and uses again, we often have politicians weighing in and saying that they cannot get naloxone more than 3 times, and after that they have to be left to die. So we really have a conflict between the medical definition of opioid use disorder and the politicians approach to opioid use disorder. What is the evidence that supports or doesn't support that the opioid use disorder person relapses? There's been one major study in Kaiser Permanente in California, where they took ED patients who had overdosed on opioids and looked at their rate of re-overdose rates, or their rates of re-overdose over the next 12 months or so, and that re-overdose rate was 7.2%, with a hazard risk ratio of 1.5% if the patient truly suffered from opioid use disorder. That's the only study that looked at re-overdose rates. A couple of studies have looked at the death or the risk of death. One big data study from Massachusetts found a rate of death or risk of death of 5.5% in the 12 months following an opioid overdose. And another study from Ontario found a similar all-cause risk of death of 5.3% and a risk of death from opioid overdose or opioid-related of 1.9%. Here in these two studies, we're using mortality rate as a marker or a surrogate marker for re-overdose rate. The big research question we sought to answer is, in a statewide opioid surveillance system that is really prospective, how many persons overdose more than once? So we used the Connecticut statewide opioid reporting directive, otherwise known as SWORD. It's a directive that requires EMS providers to report suspected overdoses to the Connecticut Poison Center. The directive covers the entire state of Connecticut, 3.6 million people, 31 acute care hospitals. It started and covered the entire state starting June 1st, 2019, and the reporting is ongoing 24/7, 365 days a year. How it works is EMS is at the scene, takes care of the overdose, and once the acute issues and problems have been stabilized, the EMT calls the poison center. The poison specialist records information in the computer, and there are a series of questions and answers that are sought. And then the poison center does a typical follow-up in the ED if the patient was transported to the ED. And then what we did was the data analysis that can occur. So we did a retrospective chart review of electronic records at the Poison Center spanning a 7-month period. The inclusion criteria are all the SWORD cases, and the same person was defined as matching both in name and date of birth. So during that period of 7 months, again, we saw 2,900 or so opioid overdose events, because each record is an event. That's about 14 overdoses per day. Of those overdose events, they involved, in fact, 2,536 individual persons. Some overdosed once, some overdosed multiple times. 2,253 or 88.8% overdosed once and once only. 283 persons or 11.2% overdosed multiple times. So of the people who overdosed multiple times, the majority overdosed a second time and overdosed only twice in that period of time, but one person overdosed 7 times, and you see the rest of the data here. So the strengths of this study, it's a statewide population-based surveillance system designed really to look at opioid overdoses. It captured information on overdose patients that were seen in the ED, but it also captured information on overdose patients who were not transported to the ED. And our rate of non-transport is about 10% in Connecticut. In contrast, the California study previously mentioned only looked at hospital-based or ED-based overdose. Our re-overdose rate was 11.2%. Our limitations, there were missed overdoses where EMS was not even called. There were overdoses that were treated by EMS, but where EMS may not have reported it to the poison center. There might be mismatching of name and date of birth that may have missed some cases, and people may have re-overdosed and died, and EMS not been called, and those overdoses would have been missed as well. These limitations would have influenced both the numerator and denominator. It's difficult to say what impact they would have on the ultimate rate of re-overdose. So in conclusion, the majority, or 88.8% of persons who overdosed on opioids had no other overdose in the subsequent 7 months, and the repeat overdose rate was 11.2%, and that was higher than what was previously reported in the medical literature, which was 7.2%. All these overdoses or multiple overdoses represent missed opportunities to intervene. In a longer longitudinal study with logistic regression would better categorize the re-overdose rates and identify associated risk factors. Thank you.